This gentleman right here with the oxygen tank. So this is a gentleman with a health care issue.
Thank you, Congressman. I'm Doug Harrington. I'm an insurance executive for 20 years and a registered nurse for 20 years. And I can tell you, you asked the question a while ago about the emergency rooms. I worked Trauma 1 here at university, and I worked Trauma 1 at university in Galveston. I can't tell you how many times we had to close the emergency room because of the overflow of just normal, everyday people needing care for things that should be done by a doctor. Unless we can come up with a plan of some kind that ensure people where they can go to the doctor and stay out of the emergency rooms, we will never fix the problem.
And my question is this, and I think it's a good follow-up to the gentleman's question, because I carried private insurance as a self-employed individual, was paid a major insurance company for years, had no claims, got diagnosed with cancer, and I got a letter that they pay for no more cancer-related treatments. My question is how will, so I think rationing's occurring already, how will this House bill address those issues?
I know that the present bill, and we know that rationing is already occurring and people are splitting their pills and things. All I know is that the present bill, I know, puts a cap on the total amount that can come from you in terms of catastrophic kind of situations, which is something that we don't have now, and I think that in that area would be helpful.
I'm Mike Phillips, the leader with the 42 Churches of Cops and Metro Alliance. Congressman, many of the members of our churches cannot afford health insurance, so when they are sick, they must go to the emergency room. That's the most expensive way to provide care. Today, we all pay for that expensive care by higher insurance, if we have it, or by higher property taxes, which we all pay. Wouldn't a public option keep costs lower and be a more practical and efficient?
Let me indicate, earlier I was talking to someone with a hospital, I think, and I might have the wrong hospital, but I thought it was the Santa Rosa, and they were telling me that they had up to 43% of the individuals that went in that were uncompensated care. So we have a large number, and this premise is just based on the premise that if everyone is somewhat insured, there is less likely to come from our pocket, and that they will be kicking in to help out in the process. And so, bringing down the cost. Not to mention that the highest cost is the emergency rooms. And I don't know if there's somebody here from a hospital that can talk about that, because I know that they are carrying a burden in that area. And that all comes from all of us, okay?
I'm Dr. Robert Ludicky.
Yes.
I just wanted to thank you for your leadership over all these years. I've seen lots of areas where you've been very, very helpful to us, and I certainly appreciate it. I wanted to add that as a physician, I've seen the 25% of people who don't have health insurance, and I assure you, a lot of those people, there is no way they can pay their bills. And I also assure you that all the rest of us are already paying for it. We're already paying for it. We need to find a better way to pay for it to be humane to those people. Do you think there is a possibility of a bipartisan solution to this problem?
I really believe the process is very fluid. I really believe that there's agreement. For example, I think we can get agreement on the pharmaceutical companies, for example. Let me share some data to you that everybody knows and agrees with. And if there's any pharmacist here or doctor, you tell me if I'm wrong. The data shows on the pharmaceutical companies that we've done the studies. We've taken the top most used prescriptions by seniors, whether it's blood pressure, whether it's heart disease. We know that when that prescription gets there, they charge those seniors from 100 to 300% higher. The same product, same item is sold in Europe and Canada and Mexico. It's cheaper. We know that. So I really believe that if there's separate bills, we can come to grips with this. We also know with the pharmaceutical companies, you look at advertisement. Why would that advertise on drugs that the doctor's going to be one filling the prescription? Are you going to be telling the drug, give me this medication? It's ridiculous. They spend billions of dollars on advertisement. Every time you see every time you see a Viagra advertisement, you're paying for it.